is going to help make a historic recovery a long-term boom. Folks, above all, this historic investment infrastructure is what I believe you, the American people, want, what you've been asking for a long, long time. This bill shows that we can work together.
President Biden clearly happy about the efforts by Republicans and Democrats to get a bipartisan infrastructure bill passed in the Senate. The president says the major investments will be made in roads, bridges, and highways, as well as water systems and broadband. He says it is critical for this nation's future. Senator Bill Cassidy was one of 19 Republicans who voted to pass that bill in the Senate. He joins us this morning. Thank you, Senator, for joining us. Pleasure to have you on the program this morning. Before we get to infrastructure, can we get your thoughts on Afghanistan? There have been so many conflicting thoughts on this. I was listening to a couple of former generals. General Barry McCaffrey said it probably was the right move because it's been going on so long. Then David Petraeus, who served over there, said, you know, it was the wrong move. I mean, where are we on this?
I think that you can debate whether or not it's the right or wrong move to stay in Afghanistan. I will say that we have minimal troops, minimal expense, and we had lots of allies to share both responsibility and expense. But that said, you can debate that. What you can't debate is that the exit was poorly planned, poorly executed, and has led to a crisis in which thousands of people are stuck there if they're Americans and stuck there if they're Afghani allies, but at danger of losing their life. That is not the way to end. You can debate whether we should. You cannot debate that this was poorly done, incompetently done.
Yeah, and I think most people do agree on that part. But under the Trump plan and agreement with the Taliban to get out, would things have been different in your opinion?
So if you had decided to get out, clearly the administration had been warned by intelligence agencies that there was a danger of the Afghani army collapsing, and there were thousands of unprocessed visa applications for those who have been our allies. So I don't know what the internal Trump plan was in terms of getting those folks out, but if you knew that there's a danger of collapse and you decided to get out anyway, then you should have been processing getting people out for months before this date. And that's where the incompetence has been shown of this administration.
Yeah, and most polling showed that Americans did want to get out of Afghanistan. Let's move on to infrastructure. Most polls show that people are for infrastructure. America's infrastructure is crumbling. Are you optimistic that the bill that got passed shows that Republicans and Democrats can work together, especially when it's for the good of America?
It clearly shows that. It also clearly shows that the Congress is concerned about the fact, we'll just pick it here in Baton Rouge and in Louisiana and in North Shore and in Lake Charles, that we have an inadequate interstate system, roads that are breaking down. We should be six-laning the I-12 all the way from the Pearl River to the Amite River in Baton Rouge area. We have flooding. I could go down the list of things that we need to address. This shows that Congress is able to address it. That's a good thing.
And how much, because there's been a lot of numbers, bandied about, how much of the $1.2 trillion will go to hard infrastructure? I've heard varying numbers on that. And there's also argument, especially by your fellow Republican in the Senate, John Kennedy, about how much will be coming to Louisiana.
Yeah, so north of $500 billion is going to hard infrastructure. $110 billion to roads and bridges. Army Corps of Engineers is getting $4.5 billion for coastal restoration in states that have been hit by natural disasters in the last 6 years. FEMA gets $3.5 billion for flood mitigation in areas that have flooded over the last several years. Now, there's some things, for example, the $5.8 or $9 billion coming for roads and bridges, it's coming to Louisiana. There's others that you could say, well, is it or is it not? If you have a provision that Army Corps of Engineers is getting $4.5 billion to targeting states that have had natural disasters hit their coastline in the last 6 years, it doesn't say Louisiana, it says Louisiana. Unfortunately, we've been the one getting hit the most. I'll also point out there's some things specifically There's $50 million to restore the ecosystem of Lake Pontchartrain. Normally that gets $1 to $1.2 million a year. Over the next 5 years, we get $50 million to help restore Lake Pontchartrain, going for ecosystems, sewer, all the other things for the parishes surrounding the lake.
Okay, so that's a lot. If we can go to masks on another subject, I'm trying to get a lot in because we don't have that much time. Masks and vaccinations have become so politicized. You're a doctor, you know, and you've been criticized by a lot of people for taking stands. You got criticized for your stand on infrastructure, and you've also been criticized on masks and vaccinations too.
So I wish I could say it wasn't true, but there's two types of folks: those that have been vaccinated and who are protected against going to the hospital and dying from COVID, and those who are not vaccinated who are at great risk. I wish that was different, but you elect me to say the truth, not to do one-liners. And I'll just say, if you're not vaccinated, you are at much greater risk of, if you get infected, and you will get infected, going to the hospital and dying. I got a text from somebody who was an anti-vaxxer. 8 people in his church have died. He's getting vaccinated and was asking me, what can he do to help? A similar from a woman yesterday whose brother-in-law just died, sister is in the ICU, have been against immunization, now she's getting vaccinated. If you've not been vaccinated, you are going to get infected. It's just a question of when, and that places you at risk of hospitalization and death. And I wish it were different, but that is the truth.
And the trouble is, there's truth and then there's opinion, and sometimes people, you know, mix the two together. Why do you think this has all become so politicized? Why is there such a divide?
I'm not sure, but I'm a doc, and I'm just speaking as a physician. If you have obesity, diabetes, hypertension, liver disease, lung disease, heart disease, and those things are pretty common in Louisiana. We lead the nation in the number of folks who are overweight. You are at much higher risk if you get infected, and you will get infected, of ending up in the ICU and dying. Some people say they don't care. I can tell you, your loved ones care, your children care, your wife cares, your husband cares. So I just ask for folks just to think about that. The vaccine is safe. President Trump was the one, to his great credit, pushed it through and got it approved. He's been vaccinated. It is something which can save a life, and that life may be yours.
But the fact is, we are seeing more problems in red states than we are in other places.
Yeah, so by the way, let's just look at it. Public health has been miserable in terms of having a consistent line as regards the message on COVID. So the folks who are not trusting government, they can look at one statement, change of the statement, a change and a change and a change. It does not inspire confidence. So I get that. And so if you don't trust, you know, who you're hearing on TV, speak to your doctor. Ask her, listen, I'm a little bit overweight and I've got high blood pressure. Should I be vaccinated? Speak to your doctor, the nurse practitioner, the PA who's taking care of you. Yeah. Ask them. They will give you the same advice.
All right, Senator Cassidy, we appreciate you taking time to talk to us today.
Thank you, Eric. Appreciate it.
Let's get over to Peyton.